What brought me here originally to Calaveras was the beauty of the environment, the ability to just go hiking and see these amazing things.
What I enjoy about living here is just its ruralness. I grew up in a small rural town.
Calaveras County has been one of the nicest areas in the United States that we've lived in.
A lot of folks like me moved from an urban area to rural areas because there's a different culture in a rural community.
We have cleaner water, we have less pollution, we have less, social problems such as gang activity, violence, things like that that you might see more common in urban areas. But we have a set of problems in our rural communities that are unique, that you don't see in urban areas. We have an older population. We have a sicker population. We have a population of people that don't have access to healthcare services that people in urban areas might take for granted. So those are the challenges in the rural communities that we're trying to help address here in Calaveras County through some of our public health activities.
What has kept me here is my work and the community.
The public health field is really changing to begin to address some disparities or inequities that happen when it comes to health outcomes. Part of that is the drive to address health equity.
For people to really get an understanding of health equity, I think it's important for them to contrast equity with equality. So with health equity, the outcome is that we want to see people all achieve a certain basic level of health. And we want to see the barriers that are in the way for people getting there removed and minimized as much as possible.
When it comes to looking at health disparities, one of the disparities that we found was that by being a smaller rural community that didn't have access to specific Calaveras County data, that in itself is a disparity.
The rural mortality penalty is something that has been discovered by comparing data from rural areas to urban areas, even controlling for things like education, race, income. And they're finding that people in rural areas have a lower mortality age. So it means that they don't live as long. There's some data out on a clump of counties. It could be Gold Country, we could be clumped in with Sacramento, or we could be clumped in with Stockton. And when that happens, it's not really representative of us, and it doesn't really tell public health how to help Calaveras County.
We wanted to address that disparity by coming together in a collaborative way to do a sound oral health assessment that really identified and spoke to the needs of our community so that we can make progress towards achieving health equity.
We collected over 800 surveys in the community, going to over 40 different community events to do so, and doing some online outreach as well. It gave us so much information that was really, really helpful. And the nuances of our county. And so from that information, in collaboration with the Oral Health Task Force, we wrote an oral health improvement plan for the county to really focus on what we can do to make our mouths healthier. The Oral Health Needs Assessment revealed 3 major themes. The first was education, and that we wanted to educate our community more on oral health. The second was access, particularly access to dental care. And the third was creating a culture in which people felt that they could maintain their oral health and they had the hope of maintaining it throughout their life.
Oral health is not just affected by visiting the dentist. That's a huge component of it, but there's so much more that goes into it, and that's what the assessment really identified. We were able to identify that housing security, having access to employment, having access to other resources really affect someone's overall health. And so as a community, we need to address the whole person.
We have worked with different organizations in the county to get that message out there. We work with Meals on Wheels to provide oral health education materials and then oral health kits to the recipients because they're not always able to get to a store to buy those.
We've been called upon education to the public. We've been called upon to screen kids in the schools. When the county calls upon me to go and talk to a specific group, we are there with education, with presence. So when there is a problem, people do pick up the phone and we do talk to each other. So we're small enough to do that, yet we're big enough that we can help quite a bit of people.
Partnerships are the strength of a small community. We know who's talented, who has connections. I think this county is remarkable. A lot of small counties are just struggling to keep head above water. Calaveras County has great leadership, and they look for innovative programs. They look at best practices.
As we evolve, we become more responsive to the needs of our community and bringing them to the table, having a discussion, identifying what their needs are, and doing something about it.
I'd like to see access that people do not have to leave their hometowns, the places they've chosen to live, to raise their children and to grow old, to receive the same services that they can receive in an urban area.
What it's going to take to make progress towards achieving health equity is collaborative partners coming together to address issues that are backed in data. Through collaboration and resources, I think we're going to really start to make progress on achieving health equity here in Calaveras County.